I'm Dr. Thaddeus John Bell. Today I want to talk to you about myocardial infarcts, or in layman's terms, a heart attack. I'm encouraged to give this health tip in memory of a very good friend of mine who passed away from a heart attack. Heart attacks in women is very, very common. In fact, in women between the ages of 25 and 44, heart attacks is the major cause of death. It is also the major cause of death in women from the ages of 65 on up. It is the third major cause of death in that age group. Before we go into a detailed discussion of heart attacks in women, let's talk a little bit about the anatomy of the heart. The heart has four major arteries that we refer to as the coronary arteries. When these arteries narrow, there is a decrease in blood supply going to the heart, starving the heart muscle, causing the heart to have a heart attack. The reason that these arteries become clogged up or occluded is because there is a buildup of cholesterol in the heart. That also plays a major contribution to one having a heart attack. One of the things that's important for women to remember is that the heart attack signs is different in women than it is in men. The signs in women are an acute onset of fatigue, sometimes experiencing what women oftentimes feel is heartburn, but actually they're having a heart attack. Also having pain that goes directly to the jaw, or sometimes the shoulder, or even may be sometimes to the back. Nausea and vomiting can also be an acute sign that one is having a heart attack. One of the things that we want to make sure that women appreciate is that there are risk factors that you must pay attention to. The risk factors are as follows. If you have a family history of heart disease, then that's a major risk factor, and it means that you should be on the lookout for, or you even should get screened to find out whether or not you have heart disease. Another risk factor is high blood pressure that is not appropriately treated. A major risk factor is smoking. Another major risk factor is obesity. And of course, a risk factor that is oftentimes not appreciated is diabetes. Leading a very, very sedentary lifestyle is a major risk factor for heart disease. We'll just make this part one. I'll do part two in just a few. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.